us. We have a great program with Highmark Blue Shield today, talking about some of the questions that you've been asking, and I think it's really going to be very beneficial for you. So I hope that you have lots of good questions and you get a lot of good answers. As usual, on the control panel on the right-hand side of your screen, you can either ask a question by typing in under the question icon your question, and we'll answer those at the end, or you can raise your hand and we'll unmute you and you'll be able to answer your question live. So again, thank you for joining us. I just wanted to take a few minutes just to talk a little bit for those of you that are not familiar with URL Insurance Group. Wanted to certainly take a few minutes and talk about what we are and who we are and what we do. As you can see from our website, urlinsgroup.com, we have very distinct departments, each filled with their own experts. Annuity Solutions is run by our Senior VP, Joe Corio. He has a really interesting concept now, the SEPs, where, you know, I'm not going to do it justice, but you can put money in. It's a simplified employee pension, something like that. You know, again, I'm not doing it justice, but bottom line is that that also works. That works with annuities, obviously, but it also works when you have somebody that is self-employed or wanting to put money into these specialized accounts to reduce their modified adjusted gross income. Therefore, it benefits them on the health side as well. So if you have anybody that falls within those categories, please reach out to Joe. Life Markets is run by Steve Clemens. He's the VP of the Life Markets division. He's experiencing a lot of activity with final expense programs for the senior markets, as well as life insurance. You know, there was an interesting report done recently, and life insurance sales are expected to increase not only for the final expense, but due to health insurance reform. So I think if you're not working in the life markets, working with Steve and his team, you might want to give that a shot as well. And of course, our Senior Care Products Division, Karen McDaniel is our Director of Medicare Operations and Compliance, and she is really doing a nice job for her division. And you know, obviously, a lot of under 65 health agents share their time with the over 65 products. And if you're not currently working with Karen and her team, you might want to also give her a shot. Last but not least, certainly, is our health plan options. We have so many wonderful things going on, truly a lot of opportunity. If you've not visited our portion of the site, I encourage you to do so. The product information button has everything you ever wanted to know and more. It has our, you know, all of our FFM-specific forms, our one-page guide, the hardship exemption form, the actual FFM site, healthcare.gov, the subsidy calculator, income guidelines, and household size guidelines. You know, those are all things that, the tools that I use probably on a daily basis, so we wanted to dedicate a certain portion of our site to all of those forms and links. Of course, individual critical illness and disability carriers, this is headed up by Christy Saul, and she certainly does a nice job. The critical illness and GAP programs are a nice combination for anybody that's buying a bronze plan or a catastrophic plan. Our individual health carriers, you see our Highmark Blue Shield Western PA as well as our Highmark Blue Shield Central PA. We just added the broker of record authorization forms to both Western and Central. So if you have written on the FFM and you're not receiving commission or you're not hooked up to that case, I would ask you to contact your case manager or visit our site and grab those forms and complete them and get them over to us. Also, our group CI and DI carriers, as well as our self-funding programs. And then, of course, our group health carriers, group dental and vision. So, again, or you know, give me a call. At the end of the webinar today, we're going to actually have a poll, and it's going to ask you simply yes or no. If you'd like me to contact you, just type in yes, and if you don't, then type in no, and I won't bother you. Without further delay, I'm going to get our webinar for today where she's the sales channel consultant of individual market sales for Highmark Blue Shield. She has a great program planned for you. Again, all of the questions that we've been asked, some of them she can answer, some we can't. You know, specifically about the extension of the extension. But I'm sure Jerry will answer most of your questions, and hopefully you'll come away learning something. So without further delay, again, I'm going to introduce Jerry. Thank you so much, Jerry.
Thank you, Deb. Pleasure to be here. As she said, I hope I have some good information to share with you, and as we muddle through this this new world of healthcare reform.
I think, yep, technical difficulties, folks. Okay, I think we're good now. You can enter there.
Okay, so today's agenda, Deb asked me to put some of these things together. Some of them may be a little much part of a review, but I'll just kind of breeze through that just to touch upon that. And then some of this is just very broad, and we don't have all the answers, as she said, but we will certainly discuss what we can expect in the future and things like that. So, healthcare reform product overview. Now, this again, like I said, is probably mostly a excuse me, a review, but I'm just going to kind of run through this, and I guess she probably has these slides to share with you if you need to reference them at all. So, we basically have these 5 categories. We have the Flex Blue, we have the shared cost plans, we have health savings, comprehensive care, and major events, which is our catastrophic. So we'll kind of take a look at each of them. First of all, our Flex Blue program. Now, I'll get into this whole Flex Blue stuff in more detail as far as the networks and how that works and everything. But basically, here's a quick overview of what this entails. And if we look at the products themselves and who may be your market for these types of plans, basically, our Flex Blue products in Central PA are not so much a narrow network. We use the same broad network for all of our plans. However, in the Flex Blue plans, there are options that we are going to refer to as enhanced versus standard, and they are just paid at various co-insurance rates, and they are based on agreements that we put together with hospitals and participating providers who have privileges at those various hospitals. And again, we're going to touch on this a little bit deeper in some of these slides. The next one is our shared cost PPO. For those of you who have been doing individual products for a while, I would suggest that these products most look like our old Advanced Blue products. So they have a higher deductible but upfront co-insurances or co-pays so that you don't have to hit the full deductible like you would in our next category, which is our health savings. So these are good for people maybe who don't use a lot of services, so they like the high deductible, and then they just like the to know what their co-pays are going to be up front. So again, people want lower monthly premiums because they have a little higher deductible. They don't expect to use a lot, but they want fixed, predictable costs for those services that they know they will be using. Health savings, again, reviewing. This is our product that we can use with a health savings account. These are what they call qualified high deductible plans that meet the IRS requirements as far as deductible levels and how the deductible is met, things like that. So there's various health savings plans that we still offer in conjunction with an HSA that can be integrated. If it's integrated, it's you can set up various methods of payments. You can either pick and choose which claims you want to get reimbursed for. You can have an auto pay to the doctor or auto pay to yourself. And our fiduciary that we work with internally on that is Bank of America. Comprehensive care. This is seems to be one of our more popular plans, which surprises me because this is our lowest deductible. But for people who they know that they want to have not that they want a higher premium, but they know that they want to have lower cost care when they do get care. This has been very popular. This plan, if you're familiar again with our old MU products, most reflects how our Direct Blue product was set up. So this really is for people who, use the system, use the medical services, and are willing to pay a higher premium so that they have, less payment out of pocket at the time of service. The major events, this is our catastrophic plan. Obviously, this is restricted to those who are either under 30 years of age or who meet financial hardship. The premiums are low, deductibles are high, but it's just basically, bare bones coverage so that you do have some coverage. Here we see, people under 30 people who are able to demonstrate financial hardship, and I don't have a definition for financial hardship. The FFM, I guess, is the one who determines that, and people just who want to have that emergency coverage, in the event that they do have a major situation. Now, I want to kind of clarify some of the things with the Community Blue Flex Network, and that it seems that we've gotten several questions regarding that, so I wanted to kind of clarify that for you. So, you'll hear in today's ACA lingo, narrow networks and things like that. Now, I have to say that the products that are in central Pennsylvania under the Community Blue Plan may be referred to as narrow network, but they really aren't. We use the full PPO network. It's just that within that network, we do have different tiering. So the purpose of creating these products was really to take note of hospitals or facilities that have the higher cost and try to direct people to the lower cost facilities if they're able to do so. All right, so we wanted to be able to separate those network hospitals and employed physicians based on those costs. So if you're familiar with these plans, you'll see an enhanced versus standard network or enhanced versus standard coinsurance. And basically, there's two tiers within this group, and the cost sharing is a little bit greater for standard versus enhanced. Now, what you'll find in central Pennsylvania, most of our hospitals and providers are in the enhanced network, and there are just several hospitals. And the next slide will define who is what. Now, this is going to be changing. These hospitals can go in and out of the various categories. I would assume that we will see the standard network probably increasing. There's only 4 in there right now, but as these products develop, you may see some various changes. So they would be contracted annually, and you would be notified, before anyone signs up and then finds out that their hospital's changed, networks or whatever. But basically, that's why we kind of came up with these products, is just to, like I said, try to steer people to the lower cost facilities, not lower quality, but just, that we have negotiated, various prices with these different facilities. Now, I apologize for the quality of this slide. This slide has been copied and copied and copied, and it looks a little fuzzy because it is. But I just wanted to kind of point out to you, down in the lower right corner, you'll see the standard hospitals. And really, there's only a few, and there's a couple up in the Danville, Bloomsburg area. They have Bloomsburg, Berwick. We have the Carlisle Regional, Geisinger, Shamokin, and out in Allentown we have the Easton Hospital. But basically, every other facility or any provider that has privileges with those facilities would be paid at the enhanced level. Those down in the corner would be the standard level. Now, what happens if you go to a provider who's got privileges at both? Well, the enhanced overrides the standard, so there's no problem there. We get a lot of questions regarding what happens if I go outside of the central Pennsylvania 21 county area. Well, you're in luck, because basically those blue card outside of the area are also considered enhanced. So because you don't have the opportunity to go to an enhanced really outside, they're all enhanced. We don't penalize you and charge a standard rate if you are out of the area getting services. All right, so that question had come up a lot, so I just wanted to make sure that you understood that. I get questions like, my kid goes to college, he's in King of Prussia, what happens when he goes to a doctor or whatever? If they're in the PPO Blue Card network, they are paid. We're going to be paying at an enhanced level. Some other facts that come up with these plans is there is cross-accumulation. So there is a combination for enhanced versus standard as far as the deductible. So they do cross-accumulate. And the other thing is, and this is the type of plan I'm in, if you do still want the qualified high deductible, we do offer a qualified high deductible health savings account within the Blue Flex network, so that gives you additional savings there as well. So it allows you to maintain that HSA and also take advantage of that lower cost tier in the network stuff. Okay, whoops, sorry. Well, we wanted to talk about the top selling plans. So let me just grab a page. Yeah, I'm sorry. I thought I had slides to refer to this, but I'm just going to go off some reports that I had recently run. Okay, so in central Pennsylvania, the #1 plan that we see is the Flex Blue. Off exchange, direct with Highmark would be the 1000, the Community Blue, and on exchange is the 2100. The second most popular off exchange, direct with Highmark, is that comprehensive plan, that $500, that richer plan. And then off exchange again, another Flex Blue plan, a little higher, the 2100. Then we get into the health savings. So basically, these Flex Blue plans have become very popular, as you see. As far as on exchange, the Flex Blue take up the first 4 top spots, and then the health savings account comes in at the next spot. The comprehensives are a little bit further down on the list on the on exchange, and I think that's because people who are probably buying them are people who probably don't want to spend the higher premium dollars for those types of plans. Okay, pharmacy. They keep telling me that nothing has changed as far as our pharmacy. These pharmacy plans are no different. For some reason, we are getting a lot of questions regarding the pharmacy plans, especially on the progressive versus the comprehensive. And I just want to point out, and if you have any product grids, I just want to point out how you can determine if it's progressive or if it's comprehensive. And if you look at your grids, on the back of the grids, basically, in the third section, you'll see prescription drugs, and next to that, you will see a footnote. And if you look at the bottom, it'll tell you if that is progressive or comprehensive, and that's key because there's no set rhyme or reason. I can't say all of the flex plans have a progressive or all of the health savings. I tried to kind of do a comparison and kind of make a general statement, but I really can't. So, the reason why this is important is, progressive, you really, if drugs are your thing and you really want to take a look at it, you really do need to look at the formularies and see what is the better drug plan. Because, some people are buying plans based on drugs because that's most of their expenses today. So when we're looking at the progressive formulary, basically it contains 4 tiers. Okay, so we have the generic, the formulary generic, which is paid at an $8 copay. We have a formulary brand. Okay, those are ones that are listed. So you have generic, you have brand. Those formulary brands are paid at $45. Okay, the non-formulary brand and generic are paid at $95, and there are some formulary specialty drugs on there. So if it's not on the formulary and it's brand or generic, it's in that tier 3. And that's how they're rated, and that's why I numbered a 1, 2, 3, 4. And I'm going to go through a little exercise to show you screen prints because I think a lot of people are hesitant to be able to find out really what's generic, what's brand, whatever. And it's really simple, so I'm going to just give you a couple screenshots to kind of go through that. As far as non-formulary specialty, those copays are going to vary. Those drugs, just the prices alone are just all over the place, so we don't have a set price. But, those specialty drug people, they know that, what they can expect. So most brands are non-formulary unless they don't have a generic, okay? So like insulin, that's an example. There's no alternatives, okay? So that's how we categorize it. Now, getting into it a little bit more, why do we have progressive versus the comprehensive? Well, the progressive really encourages individuals to use generic, okay? Or if there's not a generic, to a lower cost brand name. all right? It features the same therapeutic categories as our comprehensive formulary, but each therapeutic category contains either a generic equivalent, which means it's the same chemical composition as a brand, or a generic alternative, which could be a different chemical composition as brands. Okay, so that's how they determine that. So if there's no generic equivalent or alternative available, then that lowest brand name drug is usually included. Okay, so but if there's a generic available, that's what the progressive formulary kind of pushes you toward. Now the comprehensive formulary is exactly what it says. It's a little bit more extensive list of drugs. It has multiple drugs with similar therapeutic classes. There's more brand name products on that formulary. Even if they have a generic alternative, we do include a lot of the brand name drugs on the comprehensive. The comprehensive is a 3-tiered plan. It's $5 for generic, $20 for brand formulary, $45 for the brand non-formulary and specialty drugs. Okay. Now I'm going to kind of run through this online resource just to give you a clue to how to find this stuff. So when you log on to the website, basically, even before you don't even have to put your agent information in. You can do this pre-password. So at the bottom of this page, and I couldn't fit it all on, so I'm going to direct you to the bottom of the page, and you'll see Find a Doctor or RX. Okay, so we want to click on that. Up comes this listing. At the bottom of the listing, it says Find a Drug. Okay, so we're going to click on that. At the bottom of that page, you have your pre-reform links and you have your post-reform links. And you see there progressive formulary and you see comprehensive formulary. So you want to, look at the plan that you're looking at maybe for this member or applicant and see, what drug formulary that plan is on to see if their drugs the most popular drugs that they're using are on there. So let's click on the progressive formulary. Okay. So up comes this screen, and if you want to search alphabetically, I find that to be the simplest. So let's look at a drug, Synthroid. Okay, so we pull up the S, and we go down the listing of all the S's, and we see there Synthroid 112 micrograms tablet. Okay, and you see on the side there T2, T3, you see all that T1, T4. That's the tier, so that tells me what it's going to be paid at. So if I click on that Synthroid 112, here's what it says. Okay, so if I go to the pharmacy and I get Synthroid, that's going to be paying, that copay is going to be a tier 2. And as we said, that would be, what is it, 45, I believe, on the, okay. And then if I go and say, well, the generic is fine, I'll go with that levothyroxine, then I'm only going to pay the $8, I believe. Okay, so that's how that works. Okay, so that kind of decides, what drugs, so you can get either of them. It's just a matter of you're going to pay more for the brand drug than you would for the generic. Okay. Okay, so that's the pharmacy stuff. Now, billing and other topics. Well, let's see. I don't even think I have a slide for this because this is changing daily. But I do want to kind of review. I have some notes here. Okay, so the first thing I wanted to talk about, Deb had mentioned some of the resources on their site. If there are any cases that you wrote, any applications that you see are not getting credited to you, there's the forms that you can fill out, and basically we will hook that up with either a missing NPN number, agent number, or payment, or anything like that. So we know that there are issues. We realize there are billing issues. There are things that still need to be cleaned up, and we're just working through that. Unfortunately, I think we just got slammed in January and February. I understand from the news that February has slowed down a little bit, but we are still continuing to make sure that we want to make sure everyone gets credited for the sales. So we are continuing to develop processes as well, billing and application processes. We want to get away from the paper because that's a time-consuming thing, not only for you, but for us, because obviously we have to enter that too. And we are really working hard to get our online systems up and running. And of course, we're at the mercy of the FFM to get on-exchange coordination, but we are very close to having our off-exchange direct electronic feed. All right, so hopefully that'll be here shortly. Let's see. I think I covered all this. Oh, one thing I do have to point out, unfortunately, I do get a lot of questions. I had somebody that was eligible for subsidies. They went to the on-marketplace. You know, something happened, blah, blah, blah. Highmark's not seeing it yet. There is a delay of us getting that stuff over. And in fact, there have been times when, you know, brokers have come to me and said, you have no record of this, but yet I have gotten confirmation from the FFM of this and this and this, and we will work, you know, in identifying that. Unfortunately, you know, we are at the mercy of the FFM, and if there's anything that happens that, you know, ties up things in the system, we do you know, suggest you go back to the FFM as far as, you know, customer service issues first, because we don't always get the feed, and you know, it doesn't happen a lot. It's usually just a delay, but if it does happen, there's nothing that we can do to help. So if you have those confirmations and stuff as far as it getting through the system, that's really helpful. Okay, so continue to do that for on marketplace. Like I said, until we have an actual online through and through the system, we can't really help you on those. You know, we work with you to try to identify them, but if we don't have them, if they haven't come over, there's not a lot we can do for you on that. As I said, we're working on the new online application submission for off marketplace, and hopefully, you know, if you were with us in the past, apps are processed a lot quicker if they're coming direct to us, and there's less likelihood of errors. At this point, they have not developed that email link capability, but we are, you know, we know that that's a popular thing, so we do want to continue to work to generate that for you. Okay. So future. Let's see. Do I have slides on the future? Okay.
That's your crystal ball.
Yeah. So future. Let's just talk about what we know in the future. So currently, we're still in the open enrollment period. So for an April 1 effective date, we know that the apps have to be in by March 15th. For a May 1 effective date, the apps must be received by March 31st. Okay. And that basically is it. That cuts it off until I think the next open enrollment period, I understand, is going to be 11/15 through 2/15 for the 2015 effective dates. So unless there's an SEP, that's when the next enrollment period starts. As I said, November 15th, and this is, I put these slides together like a week ago, and of course now this is already wrong because it says it ends at 1:15, but I think it has been extended to 2:15, is my understanding as of yesterday. So this brings up the question of SEP, and I'm telling you, there's a lot of questions about SEP, and we are actually working through putting some talking points together or some kind of webinar or something, because, you know, it's really, it's not just black and white. There's a lot of interpretation, and we really want to try to help you guys, you know, figure this out and, you know, feel comfortable. And we are working with legal and regulatory and product and a lot of different people to put something together so that we have something that we can go, you know, and know after March 31st, are we really able to do this or not? Okay, so the obvious ones are, you know, if you lose your existing coverage, if you need to add a dependent or divorce or marriage and those things. But there's so many other ones that we have encountered that we really, like I said, we really feel we need to put something in writing and something concrete so that we can work with you in getting that information across. Another thing I wanted to talk a little bit about is special care. Now, if you all read the news, special care was extended until June 30th of this year. So those people don't have to do anything if they don't want to. However, because we're still, as I said, in an open enrollment period, we've done analysis of what would benefit these special care people, and we've kind of come up as a general rule of thumb that most of these people would benefit if they did change during open enrollment to an ACA product because of their eligibility for subsidies and cost sharing. We have found that most people, if they are in special care for 3 months and in an ACA product for 9 months, it's more beneficial for them than if they stayed in it for 6 months and then went to an ACA product in 6 months. So if you have anybody that you know that you want to help navigate through that, that's another market that you may want to look into. Last thing on future stuff is I'm sure if you guys deal both with small groups and individual, we have put together some toolkits to kind of assist you in working through groups that are dropping, especially small groups. It seems that unfortunately this has been a trend, and we want to help you keep that group and give them an option to go with Highmark. So we do have different flyers and table tents for lunchrooms and marketing materials and all that. And I've left some of that with Deb, and we also have online versions in PDF. So if you find yourself in a situation like that, and certainly if you have a group that is larger. I mean, I've been getting calls about groups of like 600 that think they may be dropping. Please reach out to us. We want to assist you in any way we can. If we need to have group meetings or whatnot, and try to pull this together and give them a quick education, because the individual market's a little different than groups. So we're happy to assist you. So certainly keep us in mind, even if it's not a Highmark group dropping. If it's another carrier and you want to give them an opportunity to get a Highmark product, we certainly are willing to work with you on that. Okay. So I think, let's see. Oh, I've got ahead of myself. I did talk about the SEP. We're working on getting some information on SEP, special enrollment periods, special care. We did talk about that. And I did talk about the 70% of all the special care members would qualify for tax or cost sharing savings on the marketplace, so would benefit them to move earlier rather than later. Groups dropping coverage, and brings me up to questions. Okay. So I guess I'm going to turn it back over to Deb, and she can kind of take a look at your questions, and we'll
absolutely. Well, thanks, Jerry. As usual, it's been very informative. Hopefully you found it that way as well. It does look like we have some questions that have come in. Again, if you have a question and you want to ask it, you can either raise your hand, the little hand icon, and I'll get to you, or type it in to the question box. Just before we start with the questions, I did want to mention, Jerry had talked about the online enrollment, and that, of course, gets the applications to Highmark more quickly and issued even more quickly. So many of you that have worked with URL know that you can take a paper application, submit it to us for off-FFM, and we will convert that on your behalf into an electronic submission. So that is a service that we offer for you. Also, if you do have any of the FFM issues that Jerry and spoke about, just give your case manager a call. We're certainly willing to help you get to the bottom of it. We've been doing battle with the FFM now for many months, and I think we're pretty well versed in how to handle them and how to get to the bottom of the issue. So we're definitely happy to help you with that. Also, for any of you that joins me every Thursday at 9:30 for my weekly PPACA webinars, if you have not signed up before and are interested in attending one of those webinars, just go to our website, and on the home page you're going to see upcoming events, and you can register for that weekly webinar. And we try to format that so that there's plenty of time for an open forum that we all learn from each other. So I do think it's beneficial. I've heard it's beneficial for all of us, for certainly my agent partners and for myself as well. So try to join in. Again, if you can't, they're always available on our website under the YouTube icon. All of our webinars are always recorded and available for your listening pleasure with popcorn after the event. And last but not least, we are extending our business hours. As Jerry mentioned, the cutoff for 4/1 effective dates is 3/15, which happens to be a Saturday. We're working 8 to 4:30 on Friday the 14th, and hopefully that helps you get your cases in. And we also are extending our Friday hours on March 28th. We're also working 8 to 4:30 that day as well. So hopefully that will help all of you as we come to the close of the FFM and for off-exchange submission as well. So we'll get to the questions. Ken says, during SEP, will all plans be available? And yeah, it's going on and off exchange. A qualifying event is a qualifying event, and you can either make application on or off exchange with all carriers and all plans. Abby asks the question, for the Community Blue plans, the ones that don't have listed counties, like the Flex Blue PPO 4000 Bronze level and the Health Savings Blue 1700 Silver level, does that mean they are not limited to certain counties for coverage like the other community plans? Jerry, you want to take that?
So I would say if they're not listed, the county's not listed, they're not available. So so they wouldn't even be an option to sell if they're not listed, if the county's not listed.
And Sue says, if a client goes out of area in the Blue Card network, I was told that under the Flex Blue plan, those providers would come in under preferred. Is that correct?
Well, it would be enhanced versus standard. Yes,
yeah.
Enhanced. They would be paid at the favorable co-insurance rate. Yes.
And Chris has left, but he asked the question about Hershey Medical Center. Is that enhanced or standard? And that is enhanced.
Yeah.
Sean asks the question that he didn't see Harrisburg Hospital on the list. Is that enhanced or standard?
Yeah, I think it's called Pinnacle.
The Pinnacles are enhanced.
Yeah, I would focus more on the standard. Anything that's not on the standard, I would say default to the enhanced because they might be listed under various names.
Yeah. And Mike asks the question about going to Highmark. Well, he's doing HighmarkBCBS.com, which is Western Highmark versus Highmark Blue Shield, looking up providers and enhanced versus standard. And if you do go to that provider search, you can search by specific provider name, hospital, provider. You can also, when you're specifically wanting to see the enhanced network, you must say yes to having a Community Blue plan. And that's going to bring up your enhanced providers. Yeah, the radio button that says, do you have a Community Blue plan? So, Mike, I can, if you are still having issues, if you want to contact me, I can help you with that after the webinar.
Yeah, I'll just mention that out in the western states, the Community Blue plans do operate a little bit differently. They don't have, they truly are different networks, whereas in the central part of the state, they're all in the network, it's just paid at different levels.
Yeah. Okay. In the Progressive RX plan, is insulin 45 or 95? And I don't know.
Well, it is there is no generic, so it's 45, I would think. However, it's an injectable, so it's a specialty drug. I'd have to actually look it up on that little exercise that I did.
So Sean, we'll get you an answer to that.
Typically, the injectables are considered specialty, but I don't think insulin is. I think there's a lot of injectable drugs now that are just considered brands that aren't specialty.
And Sue asked the question, she said, why in your plan brochure does it not show that all the tiers of the prescription plan? I also run across that where it gets confusing.
Yeah.
And she says also whether it is progressive or comprehensive. And it does actually, if you look at the prescription benefits, Sue, on the health plan, you'll see a little footnote, either a 4 or a 6. And if you go back to the last page of the brochure, it will tell you what refers to progressive versus comprehensive. So it does tell you what it is. It just doesn't list all of the tiers. But you will have, I'll send this PowerPoint out. It will be available on our website as well. And, I think that'll be certainly a good source for all 4 of those tiers. Sean says, do you have a list of the plan designs and what formulary is associated with the plan? Yes, we absolutely do, Sean. It's all on our website under the product information. We have details on all of the plans, on and off exchange. They happen to be the same this year, but they're all on there, so you can view those 24/7. Katrina is asking a question. She says, is either drug formulary considered a closed formulary? It's a good question.
No, we don't use the closed formulary. They're all open for us. The only one that we have, if you're familiar with group, comprehensive has an open and closed. However, in individual, we use the open.
Okay. Sue says, what is Highmark doing in regards to the canceled coverage after President Obama's extension of the extension? Yes.
Yeah. Wow. How did I miss this? I did talk about this. I had it on my mind, and then it slipped. Well, to be honest with you, we don't have our answer yet. I don't know what we're going to do, but I certainly hope, within the next week or so we have a commitment. But I think we have to actually wait for the Pennsylvania Insurance Department maybe to kind of dictate what we should and shouldn't do. I know this announcement came out last week, and I was out of the country, so I have not really met on this yet.
Yeah, and we're watching it closely. I'm certainly in touch with all of the carriers and the Pennsylvania Insurance Department. We'll certainly let you know anything that we know. There's only 19 days left, so my feeling is, why rush into anything, right? Obviously, I'm making a joke. Sue asks a question that's very timely. If you have a person coming from another country who is now living in this country, are they able to purchase plans from Highmark on the marketplace? And yeah, my answer to that is
yeah, they don't even need a social number.
Yeah.
Yeah,
yeah, and I think for Sue, the subsidy, whether they're eligible or not, is of an issue, and at this point we just don't. I don't have the answer to that, so I'll work with you, Sue, on that. Margie asks, what is special care?
Oh, special care is a program that Highmark subsidized for lower income people. And when Obamacare came out, it was one of those guaranteed issue type plans that was supposed to go away, but there was such a population that really was going to be impacted that we agreed to extend it for 6 months with the approval of the PID, just so that we could give these people some time to make their changeover. So special care is probably more for lower income people. So that's why it may be a good thing for them to go and start looking at these plans on exchange, because they probably, like I said, 70% of them are probably eligible for some subsidy.
And DJ asks the question, do you have anything going out to the public explaining about the billing issues and people being canceled? It is the agent that has to communicate to the client, and it makes us look bad, he says.
Yeah, unfortunately, I don't think we have a marketing campaign to highlight our issues, and I am very sympathetic. I know it has been a real black eye for us, and all I can tell you is that we are working through it. I know that these people in our billing area are really willing to make sure that everything gets corrected properly and that you guys get credited, and I really don't have any excuses, and I just that we know it's an issue, and we continue to work hard to remedy it.
All right, Melissa says, how do we locate providers for pediatric dental and vision? That's a great question.
The vision, you can look on the Davis website. That's who our vision is administered through, and United Concordia is our dental.
So ucci.com or davisvision.com. And Melissa, if you have questions on that, you can reach out to your case manager as well, and they can help you search that. Dawn says, if somebody goes out of state and sees a VCBS facility, are they in network?
Yeah.
Yes.
Through the blue card.
Right. And Sunny says, it's a long question, so bear with me. Has Highmark started to pay on commissions for on-exchange sales yet? And the answer to that is yes, they are trickling in. She says she's receiving commission on all of her off-exchange post-reform product sales, but nothing on-exchange. The applications I've submitted with my clients for these do have my FFM user ID as well as my NPN, and do I need to fill out that form to match them up, or will they eventually be worked out because the FFM and NPN numbers were included? And the answer to that, Sunny, is I don't know if you're currently working with your case manager and you have a list, but what we can do is kind of back into it and see what plans they have, or credited to you, and which ones they do not. And then for those that they do not, I would suggest completing that form. But let us check. Let Judy, your case manager, check prior to filling out that form for everyone, because it's probably not necessary. We did, trust me, there have been some issues. As much as Highmark has worked to try to get some of the billing issues resolved, that directly corresponds with paying commissions as well. So, the 1-1s are starting to trickle in for on and off exchange, and when I say trickle, I mean trickle, and we're starting to get some of the 2-1s as well. So, it's not an all-inclusive list, but we want to certainly make sure you get credit and we get credit, so let's work together and try to get those cases identified and then a solution for the ones that you're not getting paid for. Don says, what plans have comprehensive formula? And Don, I would just say if you go to your plan module or your plan brochure, which is titled An Individual's Guide to the Right Health Insurance, you'll see the number 4 or the number 6 in the prescription benefit. Also on our website for all of the plan designs, you're going to see what prescription benefit formulary, yes, that they have. And as far as getting materials for converting groups, I have that information, Don, and I can get you some information out. Let me write that down. Jim says, how do we go about payment with the online process? Is payment required when they apply online?
Well, they don't require it, I guess, but they won't effectuate. They won't have coverage unless it's effectuated. So I don't know how they've done it in the past, but I mean nothing has changed as far as that goes. However you suggested, is that how you suggested that they send it in with the application?
Yeah. If you're doing off exchange and you're submitting a paper app to URL, we suggest that you email or fax the application to us without the payment, or just a copy of the payment. And then if you want to follow up with the payment voucher as well as the hard copy check, you can submit that to us and we'll get that to Highmark, or you can send it directly to Highmark. Either way, we're going to try to hook up those payments, but you don't need a payment from us or for us when we submit the application on highmarkblueshield.com. Jeremy asks a good question. Is Wayne County, which is in northeastern PA, considered part of the Highmark Central region? And it is not. It is part of the Blue Cross of Northeastern PA region, and we also offer those products as well, Jeremy. So there's a whole different set of products and and websites and networks, so we can help you with that as well. And let's see here. Tim says, it was nice to issue the client verification form so late in the process. Should we go back to all of our clients and have them sign the form, or could we fax or email the form with the attached Appendix C? Tim, I would say let's first identify who is not hooked up to you, and then we can, again, as we will with all of you, backtrack and see which ones are missing. I don't think that including the Appendix C with that form is going to suffice. But, again, why do more work than you need to at this point? God knows we've all done enough work from October 1st up to this date. But, again, we'll identify your case manager as Elise, Tim, so contact her with your cases, and, again, we'll identify those that we have under you and those that we don't. Reed says, when do you need applications for someone who has an SEP to get a 5164 and so on dates? Well, Reed, I actually talked to the FFM about this, and they're going by the same cutoff date. So if you want a 5/1 effective date, you would have to, and there's a qualifying event on 4/30, such as they're losing group coverage. then you would want to make application after 3/15 so that the next effective date would be 5/1. So you want to time it that way. There are questions on the FFM now relative to a qualifying event, so that should help. Just be mindful not to put in that coverage ends 4/1, it ends 3/31 and vice versa. For off exchange, you're adhering to the same cutoff guidelines. So for off exchange with Highmark, it's the same cutoff date. And if it's off exchange, I would say, too, that if they want a 6/1, that you don't have to adhere to.
We can be a little flexible.
Yeah, they can be a little flexible if you want to get it in ahead of time. And Jim says, when should someone expect their first billing? Is it still billed at month end, 30 days ahead?
Yes.
Yes, it is. And Joe says, is rate good for all of 2014 if insured changes age?
Yes.
Yeah.
We don't up their age bracket anymore, just that one-time annual rate.
So 2015, you would expect if they retain their same plan that they would get any increase on the new rates for those specific plans as well as any age band change. Okay. Chris says, what individual products should we look at replacing special care now?
Well, probably the bronze. These people are probably, like I said, eligible for subsidy. So I think the bronze plans probably, and depending on what their circumstances in, like I said, the flex plans seem to be very popular. They're not as restrictive as maybe the name indicates. I think they're very popular, and I think they're a good bargain. And
yeah,
and you can get subsidies.
Well, and I'll add to that because, as much as this law tried to create a one-size-fits-all, that everybody fit in these nice 4 metal levels and, by default catastrophic, it doesn't work that way. And with some of the special care people, they probably could qualify for not only the premium assistance on the advanced premium tax credit, but the second level of subsidy, which is the cost-sharing subsidies. And depending upon where they fall in their percentage of the federal poverty level, they could get a silver plan changed into, a 94% actuarial value with a $100 deductible and $500 out of pocket. So again, every person really has their own specialized needs, their specialized budget. So bronze would probably be a good place to start, but I would look at the silver definitely too, based on the cost-sharing subsidies available. Here's a question specific to Western. Are UPMC hospitals participating through 2014?
Yeah, I think that's the cutoff. I think that they have, that's what they agreed to. But now, we're still in negotiation with that. We don't want to lose them in our network. So we still are battling that out. So we're hopefully come up with a solution for everybody because we don't want to restrict the network.
Right. Melissa says, your rate sheets and benefit summaries do not indicate how long rates are valid. Can you confirm that all plans, rates, and deductibles will reset for all enrollees on 1/1/15?
Yes.
Yep.
Well, and you'll be notified prior to the 11/15 open enrollment date. It'll be just once a year. And yeah, unfortunately, I didn't even notice that because I guess we assumed that we only ever did that. I know other carriers do quarterly, but we typically just do annually.
Right. Abby has left, but she said if someone has a community blue plan and receives care outside of one of the counties, does that mean they don't have coverage at all, or how does that work? You did explain a little bit, but I think it's worth repeating.
Yeah, no, outside you're not restricted to the 21 counties. You can go to any PPO network provider and through the Blue Card network and receive actually the enhanced benefit level.
And Jim asks questions about the billing. He wants a quick overview of the online payment process and when to expect the first billing. And is it still at the end of the month?
Yes, it is. It's still at the end of the month. Basically, there's no change. There has been no changes with the billing. I know some people are waiting for the bills. They don't come. We can't force a generated bill, unfortunately. I know people are having issues with that, but I'm not saying there won't be any changes. I mean, we are kind of tied to our standard billing, and there has been no changes on that.
And yeah, I mean, as far as the online as well with the FFM, it's my understanding that, well, I've heard two things, and I've seen one thing. I've seen that it doesn't work when you go to make a payment on the FFM online. It just says, do you want to be billed? And the answer is yes. I have heard from one agent that it did work. So, you know, again, I don't know if it's a systems issue or if it was just my experience initially, but I'm doing an enrollment on Thursday, and hopefully I'll be able to have more information at that time. And Sue says they're still having issues with Highmark stating that a bill was not imaged in the system. So even when my clients have called, they have had trouble getting coverage paid for because they are told that there is no bill image in your system yet.
I would say just send that specific thing to me. I can look into it. We have somebody that we can escalate billing issues to. So if it's something that you have a specific need for, go ahead and send it to Deb.
Yeah.
And I'll be happy to send it up the line to expedite any research that's needed on that.
Yeah. If anyone has any billing issues, please contact myself or your case manager. We'll correspond directly with Highmark and get those issues resolved. As Jerry said, they have somebody to escalate those issues to, and we're going to take full advantage of it. We have it recorded. We're going to do it. Sue says she's run into people who are losing special care but do not earn enough, or at least at the right income. They don't qualify for Medicaid or a subsidy. Do you have suggestions for them? You know, Sue, the only solution, the only concession, if you will, for somebody that falls in that black hole, that they're under 100% of the FPL and above the current Medicaid guidelines, the concession that the government has given is that they're able to apply for the catastrophic plan, no subsidy, of course. The theory behind that is that it's a lower cost plan. So that's really the only concession. It's not much of one, but it's the only concession that's out there now until you know, the governor's Medicaid expansion proposal is accepted. Don says, how will we be notified about increases next year?
You know, we will send out producer alerts and, you know, basically issue new marketing materials and rate sheets and everything prior to open enrollment, hopefully, which is 11/15. Typically, we have our rates and everything approved by the PID and work on getting them out in October.
And Josie says, can we submit business on or off exchange market on SEP? Plus, who determines the SEP? And the special election period is determined by a very specific list of qualifying events, and they either have that qualifying event or they don't. So it's determined, it's for both on and off, and you know, it's really determined by the guidelines set forth by the federal government. And Steve says that it's worth mentioning that subsidy versus tax credit, it is accurate to say that the savings is actually monies they would receive as a tax return, so they don't get it for nothing, and I would agree with that. And last question before the poll question is sent is from Joe. He says, why didn't they make the catastrophic plan HSA compatible? The only thing needs changing is the 3 free doctor visits.
That's a good point. Yeah, because I mean the deductible levels there and everything.
Yeah. I think that when the guidelines came down, Joe, that I mean it was very specific about what they had to kind of include in this catastrophic Young Invincible plan. So I'm sure carriers would have wanted to really push them to the HSA. And quite frankly, the bronze plans are, you get a lot more bang for a little bit more buck for the catastrophic versus bronze. So, you know, I guess we could ask why about a lot of things for this law at this point. But so that looks like the end of our questions. Again, I thank you so much for joining us. I thank you, Jerry, for coming over and helping us out. And just to remind you, when you get the poll question, select yes or no, and I will contact you if you say yes. So again, have a great day. This will be available for you to view off of our website shortly, and thanks again. Don't forget to join me tomorrow at 9:30 for the PPACA webinar. Talk to you later, and have a great day. Bye-bye.